So I hope everyone really enjoyed the poster session. I think that was a really great snapshot of just a little bit of the research that's being done here at Stanford. And so next, we have a new idea that we've never really implemented at one of these events before. And so I think it's really exciting. And what we really wanted to do is to give both patients and caregivers the opportunity to really share experiences. I think everyone in this room understands for a disease like a neuroendocrine tumor how much information the patients and their support networks actually have. And we wanted to make sure that we would provide the opportunity to get some of that knowledge out there and just to keep facilitating those side discussions that everyone is having. And so we're very lucky we have Dr. Kogan and Natalie Newell here to moderate this panel, but I just wanted to start off by just really briefly introducing some of the lay people that we have up here. And so on the far right, we have Susan Helmrich. Susan. And Susan, you know, when I talk about Susan, I always say Susan has had a lot of cancer, and she's incredibly positive, and she always seems to find a way of keeping that positive focus and just getting from day to day. And I first met Susan because she is a really avid swimmer and a really talented swimmer. And I know swimming has been really a source of strength for her. And so that's one of the reasons I really thought about bringing Susan onto this panel. And so then next to Susan, we have Wayne Firsty. And Wayne is a caregiver. And I know, like many caregivers in attendance, Wayne I think is probably a great source of support for his wife and a great source of information, and we wanted just to make sure that we had Wayne up here to represent that perspective and how supporters can be helpful and also have knowledge and share it as well. And then to the left of Wayne, we have Don Foster. Don is a patient with, I think his primary was a pancreatic neuroendocrine tumor, and like Susan, you know, Don always has just this super positive attitude. We first met Don in 2009 at the Great Race of Agora Hills in Los Angeles, and I think Don has been to 4 of our athletic and patient education events since then. And you know, certainly Don was here last year, and he wasn't able, despite the fact that he's a marathon runner, he wasn't able to run in the Palo Alto Moonlight Run, but he did, with a recent hiking injury to his knee, he did the 10K last night, so that's pretty phenomenal. So it's really exciting to see Don here today. And then to the left of Don, we have Jan Naratomi Hart. And Jan has a fan club. She's joining us from Southern California, where she's very active in the SEA4 support group and also in the Redondo Beach group. And Jan, I believe, is also a pancreatic neuroendocrine tumor patient. And I know she's also been involved in quite a few clinical trials. So we really tried to put people up here that have different perspectives and hopefully will offer differing opinions. And then, George, I don't know if you want to say anything.
Yeah. I'll stand up here, but I think I'm largely superfluous. My wife would have agreed. Do you have specific cases, or do you want to? Yeah. So I will introduce Manuela and Natalie then. Manuela has been a gift to our program. As an MD, her interest has been in sort of behavioral psychology, and we're pleased that she's taken an interest in cancer-specific issues that arise and people coping with their disease or how it affects relationships. And she's been a tremendous resource to so many of my patients that I thank her for joining us today, giving up a part of her Saturday, but also, more importantly, helping all our patients. Natalie, I'm just delighted about because we, at one point, had one social worker for the entire cancer center. We managed to convince the people that we needed many more than that, and Natalie has since become our GI-specific social worker, which is tremendous because GI cancers in general and certainly neuroendocrine tumor patients specifically have a set of issues that are really set them apart from breast, lung, and a number of other types of tumors. And to have social worker expertise on a disease and its accompanying problems is a tremendous help. And Natalie has taken it upon herself to run a couple support groups that we have. So Natalie, thank you for coming, and Manuela. So I will be a fly on the wall and only comment if there are medically, I'll only comment if asked, which might be the first time I've ever said that. So Manuela, go ahead.
Thanks for the introduction. Thanks for having me. You know, medicine has made so much progress technically in chemotherapy, surgery, but something that sometimes gets forgotten or hasn't developed as much is how it affects people emotionally, how it affects people socially, psychosocially, and how it affects families. So whenever someone gets sick, it really affects the whole system they live in. And there's so many aspects to that we can talk about. So we have a few questions here we're happy to answer. But then I also want to just open the floor to whatever you want to ask, from me, Natalie, and thanks for all of you for coming up here. That's brave. So unless, someone wants to comment or ask something now, I propose that we start with the first question that someone submitted. Anyone wants to jump in?
I think why don't you fuel the pump, and I'm sure we'll get more.
Yeah. So I'll start. Some of the questions that were submitted aren't really psychosocial questions, but address like complementary medicine, integrative medicine, and I can comment on them briefly. But one I want to pick out here is please share best practices on how to support family members with this disease, because these can be slow growing and have mild symptoms. It's easy to almost forget the person has cancer. Perhaps someone has a book recommendation along these lines. So very, very important comment. People, whenever they hear that they have a tumor or they have cancer, that word is very scary, and many people mentally jump to the conclusion that they might die soon, or that their partner might die soon, or their family member might die soon, when in fact that's not the case. It's more about living with an illness than dying from it. And I don't know if the caregiver that is in the role up here wants to comment.
I guess the first thing is so we've now been living with this for 3 years. It'll be 3 years next month. And so as much as I say that it's great to know George and Emily and Pam, I wish we knew you guys in other circumstances. But one of the things that we spoke about is what we call the new normal. And that is just things are changed, things are different. We have 2 kids, a 6-year-old and a 10-year-old, so one was 4 and one was 7 when the whole thing started. And I will say my spouse Julie, who's sitting in the back, one of the things that we tried to do is tell them a little bit about what was happening, including they visited when we first were in the hospital, or they know that we're going up to Stanford for treatment. So from a family dynamics, they kind of know what's happening. They're young, but I don't think we go into all the full details. But they kind of know what's happening, and that's kind of the best we do. But one of the things I did want to touch base, you talked about other types of therapy, integrated medicine. That's something that we actually do a lot of, or Julie does. And one's called Healing Touch, and it's kind of like a Reiki healing thing. And the other's called Body Talk. But really what we're trying to, what it's about is mentally she's got to be in the game. As much as the medicines are there and the trials and the chemos, is that sometimes it's just the stress is high. And going to these sessions and coming out an hour later and I say, how do you feel? And she says, more relaxed. And I think that's a big part of, from a caregiver perspective, is to know that if she's relaxed and not stressed, and she can mentally focus on the things that need to happen. If I call it, her head's in the game. And if your head's not in the game, it doesn't matter what else is happening. And so from a spouse perspective, the best thing I can do is to be with her, to take her to all of them, and to be there and to make sure that when things are tough, is that we got to go back and like I said, is to try to figure out how to get, if you want to call her head, back into the game. And that's probably the biggest thing.
Yeah, thanks for mentioning the stress aspect, because that in itself can be very stressful to people, that they know they should be relaxed, that it's beneficial for health to be relaxed, and then when they're not relaxed because you're going through a very stressful experience, that stress adds on to the stress. So you're stressed about being stressed. And how to maintain a sense of well-being despite the stress, both the ill person and the family or partner goes through is very, very important. And there are many things one can do. I see a hand up there. You want to share something about that?
Associating, I didn't want anybody to come up and tell me, boy, you're too bad and all this other stuff. So I've kind of alienated myself from people. I just talked to this young man in front of me, and he feels the same way. People call up and, we're sorry and everything else, So about 7 years ago, I just cut it off. I just stopped doing that. I don't, I talk to guys that are sick, and we do things together, or if we do anything. But I became really a loner, and I'm very happy with what I do. I build walls around my house. I do a lot of things. My attitude is not to get up in the morning and feel bad and talk about it. My attitude in the morning is to get up, and my nutrition is terrible. But peanut butter and muffins in the morning, and I don't eat until 5 o'clock at night. So, and I have diabetes. So, but the thing is that I think people around me were really affecting my outlook on my health by depressing me and making me more aware. Right now, my daughter's 32, my son's 27, 28, and we've been married 41 years. And they get in the morning, they treat me like, hey, you know what? You're perfectly well. Go outside and go to work. Quit complaining, because my back hurts or something. But I don't like to be around people when they start making me feel sick. Maybe that's the word.
Yeah, thanks for mentioning or sharing that aspect. This is an illustration of how stressful it can be for partners or people, in your surroundings, and they start commenting on how you presumably feel when in fact it's not your reality. All you want is live a normal life, and your new normal is, resume your old normal. And that's wonderful to hear. Realize though that not everyone approaches it the same way, and so we have
a
patients
volunteer
up
at the
here,
end.
yeah.
Go ahead.
And so I would love to hear from you with respect to being normal versus addressing well-being or seeking help and care.
Well, I'd like to speak on behalf of being a patient as well as a caregiver, and not so much a caregiver of someone with cancer, but for someone with Alzheimer's. So I was doing that when I was diagnosed 8 years ago. But I'm a true proponent of support groups, and I know a lot of people poo-poo that because they think support groups are there to, you start crying and you're depressed and everything, but the support groups that I've been to, and I go to 3 of the specific neuroendocrine carcinoid ones in Southern California, and also a general cancer support group at the San Diego Cancer Center, which is a very, very rewarding. We come out of there laughing and crying and everything, but I think it's just speaking the same language. A lot of people that come to our support groups feel that when they walked in, they didn't know what to expect, and they were feeling alone, because as loving and caring as your spouses and your family may be, no one really knows what you're going through when you have the cancer diagnosis. And so when they come into the group, they feel like they can let their guard down and really let their true feelings come out. I think that especially for the neuroendocrine and carcinoid patients, because it's such a rare cancer, that it is doubly rewarding to be part of a support group. And you don't have to be in that local area. We support people all over the country, whether by email, telephone calls, or mail. So just getting connected with other people with the same type of disease is very rewarding, I think. And I'm also involved in a lot of integrative therapy, so if you have any questions on that, I truly believe in that as well.
Don?
Just a couple things. One, there's a new normal, which I think Wayne mentioned, and I'm doing relatively well right now, whatever that means, but it's always in the back of your head, and it never goes away. And I do have a wide variety of friends and family, and I love it when we just have what I call a normal day, that no one mentions that Dawn is sick, and because after a while it gets old. And so it just, like, we go out and do something and everybody was laughing, and I get in the car and drive home. I go, well, that was fantastic. Because it never goes away. And I do think you have to manage your stress. And I think the doctors take care of us, our physical body, but it's up to us to take care of our mental well-being. And to me, the mental well-being is just as important, or even more important, because if you're not doing well mentally, it doesn't really matter how you're doing well physically, in my opinion. And so I always look forward to having a good day, being positive. If I get a little stressed out, try to exercise, and that works for me. But I'm very aware of my mental state of being. And again, I feel that's my responsibility to manage.
So I knew I couldn't shut up. That's a wonderful point, Don. And I'll tell you that in a busy clinic, and many of you waited hours, unfortunately, to see one of us, Pam or me, and we focus on the physical, we focus on the scan, we focus on the labs, and we try to impart what sensitivity we can in 10 minutes, 15 minutes, and then get you out the door for the next treatment. And I realized after doing a similar session like this with the pancreas adenocarcinoma group that we were way off base, and that was not what the people needed. And it's not just you think that, well, maybe it's as important. I agree with you, it's much more important. And so what we've started to try to do, and one of the reasons why we're delighted to have Natalie there, is I'm not in tune with all the issues that go on, and sometimes a good nurse practitioner will kick me, like Marguerite, to tell me to pay attention. But now I'm more and more introducing Natalie to patients who look for all the world healthy and well-adjusted. And I let Natalie come up with clues as to who needs to see Manuela for a more sort of interventional discussion of problems and possible solutions. And I'd like Natalie to comment, and then anyone else on the panel, about, are you not reaching out to the right people? Or are you afraid to ask your doctor for fear that looks like a weakness? Do you have resources, professional resources, that can link you to the right people, even if it's, like you say, the support groups, which can be wonderful?
So I think that there have been a couple of different themes that have been brought up already, one of which is how to go about managing relationships. And that's something as social workers that we meet with people to try to help them come up with ideas based on the resources that they have, or by linking them to the resources that they need. I think it was mentioned here, some of our friends and family members are very well-intended but don't always know the best ways to help us. So I encourage people to ask, and then really encourage patients to think about how they respond to that question, what can I do to help you? Because often people need a little direction, and maybe even need to be told that today I don't really want to talk about my illness, but if I need to talk to you or I need to reach out for support, I will do that. I think another more practical way that we have people managing relationships is if they can identify a point person, maybe a family member or a friend, that can help field some of those phone calls, some of the letters, some of the emails, and hopefully have an effect where we're reducing some of the stress to the patient. Another thing that's been brought up is the complementary therapies, or things like support groups. As Dr. Fisher mentioned, we do have a support group at Stanford for pancreatic cancer, as well as a number of other support groups, and I agree that they can be an excellent opportunity to network with other patients. It often has the effect of reducing feelings like isolation with one's disease. So if people are interested in more resources of that nature, please feel free to get in touch with me. I'll be around after this session, and maybe some other panelists have some other thoughts on that.
I do, sir. I think that a lot of the major medical centers across the country, at least I know in Los Angeles and San Diego, they're starting to have integrative and complementary centers, or that like at the San Diego Cancer Center, we have a lot of volunteers that come out and do Reiki, Qigong, yoga for everyone, and it's free to anyone who has cancer. And I think that reducing stress is such a huge, huge part of of your journey, because ours is an incurable and long-term illness or disease. And so mental attitude, though, has been proven to affect your physical. So as long as you're trying to get yourself de-stressed and less anxious about scans and labs and everything, whatever you can do to do that, I think is the most important on a daily basis. And then you can take those practices home and try and incorporate that and make your day a little bit better. And if you reach out to your wellness communities, if you have any, because they're just really getting to be more widespread. So they're out there if you search for them, I think.
Just a quick note on that, in reference to the wellness communities. For those of you that do live in the area, there's one in Mountain View, and there's also one in Walnut Creek. And what they do is offer a variety of workshops and classes that are aimed at stress reduction. So things like Tai Chi and things like guided imagery. And then they also have weekly support groups, and they also offer individual psychotherapy to patients as well, and caregivers.
Can I just ask for a raise of hands of how many people consider themselves a member of a support group? And how many would like to be who are not? Okay. And I'm sure some of that is geographical, but certainly with the number of people in this room, I think that we could at least give you some recommendations. Good.
I would like to add one thing. You know, there's a lot of talk about stress or being strong. And I think our doctors are actually heroes, but sometimes they do horrific things to our bodies. And
Thanks, Don. That was a compliment, right?
I've been Dr. Visser. But, you know, if you're not doing well and you can't take it any longer, you don't have to be strong. It's okay to say, I'm done. And, you know, if you've made peace with your maker, I think it's okay just to walk away from this. You don't have to prove it and be strong for other people. You need to do what works best for you. I'll stop rambling now.
I would like to comment on what you said earlier, that, you know, you're responsible for your mental health. You know, George is responsible for your body, but it's the person's responsibility to be mentally well. And there I want to encourage you to view your emotional or mental state the same way you're viewing your body. So if you can't take care of it yourself, seek the same help you would seek from a primary care doctor if you have a sore throat. We live in a society where people often have a sense that if they take care of their mental and emotional well-being, it's some form of weakness. And a lot of society doesn't have the skills to take care of their emotions and mental well-being without help, because we weren't taught. The same way you wouldn't administer your own chemotherapy because you wouldn't know how. And so look at emotions and the mind as much being part of the body as your liver or your heart. And if you can't figure it out yourself, I want to encourage you to seek help. Please.
So I think I have it. You properly. So building on something that Natalie actually said earlier, are there any tips from the panelists for dealing with friends and family members when you break the news to them that you have cancer? Of course, support is always wonderful, but I think sometimes that can be a little bit draining, and it can be hard to.
I've changed it a little bit because first of all, I want to laud and applaud my most wonderful advocate, my husband. And he is always there no matter what. I mean, he'll show up on his motorcycle with flowers, and even in the rain. He's understanding of all the nasties and the goodies and everything that goes along with this disease. And I'm really appreciative of that, of his support. And secondly, I think that we fail, certainly being in the profession, we fail to acknowledge our nurses, our doctors, our social workers. For a while there, I went through this angry phase where I was just so angry that yet one more cancer to deal with, and And then comes acceptance. And now I say thank you. I mean, I give myself my own injection and they just watch. And I do that because I don't trust that it's just a control thing probably. But bake them cookies or a cake every now and then. And what really tweaks me, and this is part of the question, and I read this article in the New York Times where people look at you and they say, but you look so good. How could you have cancer? You look great. And they give you all kinds of tips. The book is about to be published, and I can't remember the name right off the top of my head, but if you go visit someone, the author suggests that you go and you do something for that person without asking. Empty the garbage. Talk about, the latest thing with the Kardashians. I mean, everybody likes, gossip instead of, just doing over them or doing for them or putting you in that sick role. Pardon me, and the last thing I want to say is I joined a support group at Kaiser called Cognitive Behavioral Therapy, plus seeing a psychiatrist, and because I couldn't sleep, I was up till like 3 in the morning, and he put me on a little bit of Bremeron, and that has done the trick. But more than anything, to be able to go into a room full of people and learn behavior modification and learn how to live one's life in the now. Yes, I have cancer, but I also have life. And this incredible, beautiful group of people and friends and partner and pets and et cetera, and appreciating the moment. And it's made my life a lot juicier and sweeter because I have cancer. So I guess the message is acceptance and, that juiciness that comes along with life is so short and so precious. And I've been given this key to look within and to be able to say, okay, I'm getting older, I have cancer, therefore my life maybe is a little shortened, but at the same time I'm so appreciative for what is. And that's not true every day. I mean, there's days when I tweak and freak, but for the most part, I really look forward. And then the alternative medicine part, I just started working with an acupuncturist who is an expert he deals mostly with oncology patients, and he hooks me up to a cactus. And at first I thought, why are you bringing the cactus in? It's like warm out there. But, a needle in my head, and then I'm hooked up to the cactus, and
Sometimes we do that to make the chemotherapy seem easy.
He cured my diarrhea. I mean, since he started doing that, I'm only having 1 stool a day. And that's amazing. And I also work with a shaman, and sometimes I call him in the middle of the night, and we hi-ya, 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 and blow the bone whistle and the feathers and my rattle, and whatever works is along with conventional, traditional Western therapy.
I want to pick up on what you say, whatever works, because it's so important that you acknowledge also the individual differences everyone has. Someone mentioned how important it is for them to not talk about it. Someone else mentioned how important it is for them to talk about it, so that you realize there's not, one mold for everyone, and to really find out what works for you and your family or caregiver.
I can speak to that. I first had cancer when I was 21. I had vaginal cancer when I was 21. I then had a endobronchial carcinoid tumor when I was 42, and 2 years ago I had a neuroendocrine pancreatic tumor. So for me, I'm now 55. For me, my normal in my life really has been having cancer. But I never really live my life like I have cancer. And so for me, what I think has worked is denial. It's really great. And I have done a lot of alternative therapies, and I was a patient here at Stanford for 23 days in the hospital. And while a patient here, I had someone come in and did acupuncture every single day. I had massage therapy here every single day. It was amazing. But the minute I got out of this place, I was no longer sick. And I would not allow myself to really, I got up every single morning, I got dressed, I walked as much as I could. I swim every single day. And so for me, denial really is my tool and my savior. And it's not that I don't acknowledge that it's hard, it is hard. And the other thing that I have done, which really has helped, is I've reached out to my entire support system through the internet. And there's a video of me on the internet, I have blogged about my illnesses, and I have reached out through email. So some people might get these emails from me and say, oh my God, what is wrong with her? But the little responses that I get back every day from people really helps. And so, you can live your life being sick, and some of us I know really are, and I have really been. And then there is the attitude that helps. And I think having a positive attitude can really help. It doesn't do it all, and we do get depressed, and we do have to seek professional help. But I think there is a lot that we can do for ourselves. And just one more thing is that because I've had cancer so many times, I do believe every day is a gift, because I never thought I'd make it to 55. So I do wake up every day saying, today's a bonus day. So I think when we do have good days, if we can appreciate those good days and really acknowledge that, I think it helps a lot. And I tell people a lot, having had cancer 3 times really helps you figure out your priorities really quickly. So I think those are the things that I can offer.
Can I ask who? Yes, thank you. I'm not sure we're applauding denial or not, but it sounds like a strategy that works.
I'm here.
Can I ask how many people have sought and found some comfort in the cyber world and internet? So
Internet.
yeah, so internet, blogs, chat rooms, groups. UCLA is doing an experiment with their breast cancer survivors, wondering if they could sort of amplify their efforts on a daily blog to breast cancer survivors to see whether that would have an impact. We don't know the results of that yet, but that would be something that support groups could advocate for. We could try to find some way of implementing that through the various advocacy organizations, if that was actually something that we found to be of use. Frankly, I can't return my own email, so I have a little trouble getting on anything, but I think that might be helpful in our modern world.
One of the things that we've done is, and it's different than, I guess, is how to tell friends and stuff like that, is we send out, I don't know, maybe it's every 2 weeks, maybe it's every 3 weeks. It's just a general note to only our friends. So it's not something that's kind of put on Facebook of kind of what the status is. But that may be only one paragraph, and then the other 2 or 3 paragraphs are how the kid's doing in school, where did we go on vacation, what else is new. And so it's not as if it's this one email of, gee, Julie's sick, and that's all that matters in our life. And it's really is, the last time we sent this out, we included 8 pictures because we went on vacation. We went to a ranch in Colorado, and the kids just started school, and work is still good, and on and on. And so I think it's just become another part and not just the only part. And I think that's, when you start saying where it is you have to somehow say is, yes, you deal with it, but it's not the only thing that goes on, and it's the other stuff that's really what's important and what keeps you going.
Yes?
I vote for total denial, by the way. One of the things that we did figure out, one of the things that we did figure out very early on is you need to tell people what you need from them. And the first thing when we got the diagnosis was, don't call, please, because we weren't in a position to really address all of that. The other thing that we do, though, is very similar to what you do. Like it or not, there's a very select few of people that get a 12-week CT scan status with the comment that says, you know, this is where we're going on travel or, you know, et cetera. But it helps people keep in touch with what you're doing, and it really tells them what you need from them. And oftentimes the receiver doesn't know what to ask.
What we also find is it gets people from saying, so how are you doing? So how is she doing? We don't have to answer that question because people already, the ones who we want to know already know. So when we do get together, it's talk about everything else.
That's a good point.
I think what helps too, I think most of you know about the free services called Caring Bridges and Care Pages. And you can elect one of your family members to be the one that gives the status, and then that way you can say no phone calls or whatever, and it gets to all the people on your email lists, and that's a good way to keep communication with your friends and family and all those who care about you. So those are, you can just go on the websites and you log your little bio, and then send updates when you can, but you get all the responses whenever you want to read it, so that way you don't have to deal with sending out emails or worrying about phone calls. It's Caring Bridges or Care Pages, both of them.
I think we'll just take a couple more comments. Tom, you have a?
Is there a network? We were talking about it, and it did come up when you first diagnosed me. I get the Sandostatin every 3 weeks.
Hold it close.
Oh, I get the Stanford every 3 weeks, and my wife gives it to me because she's an RN. The young man in front of me just started with it, and he's talking about going on vacation and somebody giving him the shot. Is there a network, like in the United States somewhere, where you can call ahead and say, hey, you know what, I got to get a shot on this date, but I don't want to go all the way home, or something like that, or you can travel? Because I felt like I was really stuck where I was at with that shot.
Good question. We like to lengthen the leash so people can have a life and not be tethered to a cancer center. And almost any oncologist would be willing to do that, providing you have advanced authorization, because oncology offices don't like to give $12,000 shots unless they know they get reimbursed for it. But generally speaking, that can be done.
And just to add one thing, a lot of people call us and ask for help if they're traveling, and we can usually help find a doctor that we know of in the city that you're traveling to that knows how to do the shot.
Good point.
I've heard the phrase cancer trumps everything, and I think we have to be sensitive to other people. They have lives, they have problems, and something that's helped me a lot is reaching out to my friends and still acknowledging that they have lives and everything isn't perfect and they need my friendship back, and that's really helped me a lot. I go out of my way. Even people that don't live around here, I call them, and I really genuinely express an interest in how they are.
I think that's a wonderful point. In fact, I think that cancer patients have a lot to give, and we have a lot to learn from the experiences that only you have had, and whether that's somebody with a problem that's unrelated to cancer that might value your advice and friendship nonetheless for the cancer. So that's wonderful. Not to mention the fact that I'm sure you get something out of that too. One more? Here comes a microphone for you.
I just wanted to address the fellow that asked about getting your injection out of the area. We're Kaiser members, and so I can only speak to Kaiser, but we did that one time, and my doctor said, sure, no problem. My daughter-in-law is an RN, so we picked up the Sandostatin, kept it on dry ice, and took it with us. What he did not tell us was it was several $100s because it was considered then an outpatient procedure. So just be real careful and check on that, because it was a total surprise. It wasn't until we picked the medicine up that we found that out.
Okay, one last question, then we'll move on. Cynthia?
I just wanted to share that we have been able to get free airline travel to an oncology appointment out of state through National Patient Travel, and you have to register with the American Cancer Society. They'll give you a number, and then it's amazing. I mean, it really has helped us. And I also found a foundation which By contract, I can't tell you the name, but I found them online, and they paid for my entire PRRT treatment in Basel last year.
Oh.
So keep looking.
You're going to be accosted right after this, I'm afraid.
George, one more.
Yes, okay.
I'm usually a pretty positive person, and the denial thing works. But sometimes I'm in a dark place, and I start feeling sorry for myself and start thinking negative things. Is there some techniques that you've done to get out of that hole?
Why don't you take that, Manuela?
So, I mean, there are numerous techniques what you can do to shift the mood or shift your thinking. I can't demonstrate them now, but if you're interested, come see me. But that's a very, very important thing that can be done, and actually relatively easily be done. It doesn't require 10 years of therapy. So.
I find exercise gets me out of the dark place. And then, you look at why are some people positive and some struggle more. I just think it's genetics. There's not really an answer why. And I think for some people it's easier and for some people it's harder. But you have to find out what works for you.
But don't be afraid to ask for help, I think is the bottom line. And don't expect, like Tom said, that your friends always know the right things to say. I mean, they're going to be well-meaning, well-intentioned, but sometimes you just need a professional. And I think that's the bottom line here.
Well, and don't assume you're doing anything wrong if you have feelings of feeling blue or down. That's part of human existence.
I think that's the normal reaction when you have first diagnosis of cancer and you're thinking all these crazy thoughts. But I think for me too, the integrative programs and complementary things, they're not whether you like yoga or you like qigong, but it's basically to take your mind off of things, and you can spend that hour and think that you're spending that hour taking care of yourself and trying to get a little bit more control over your life. And so it's going there to relax, basically, and learning these techniques to try and get out of those spaces. And that's worked for me and a lot of other people that I've seen that have gone to those dark places. But it is the roller coaster ride with the emotions that everyone goes through, I think, and especially with neuroendocrine, because you may have hormonal secretions that cause that.
I would just say that buying your mayonnaise in small jars is not environmentally friendly. I'd like to thank our panel. Thank you. And I will add, by the way, that this is another example of us listening to your evaluations. This was requested from the last group, and so please give us feedback and how we can improve from year to year. So thank you very much, everybody.